An opportunity for discussion. This is the 15-Minute Wonder on South Waves Radio.
Hello everybody. I think it's time to listen to Dr. Chan's Minor Ailments Forum again. So first of all, I hope that you all had a really good weekend, and I hope that you will have a very good week coming up as well. So if you have tuned in last week, then you would know that we talked about high cholesterol last week. So at the end of the last show, I said that I will talk about the medical treatment for high cholesterol. In particular, we're going to talk about statin, because this is a big topic on newspaper. Most of the time you hear about statin, there's something bad about it, saying statin is bad for you or don't take it. So I'm here to give you some information of the pros and cons of statin, so you can actually make a decision of whether you want to take it or not. So this is a day-to-day scenario for me when a patient come in and we have calculated the risk factor of the likelihood of getting a stroke or a heart attack in the future. And I would say, look, your risk is quite high, so I think you might benefit from taking a statin. Or in some circumstances when they actually had let's say they had a stroke, and I said, look, it's better for you to be on a statin to reduce your risk of having another one. Now, the first thing they said to me would be, oh, I'm not sure about that, because I haven't heard anything good about statin. And in fact, my friends who were all on statins before telling me how awful this drug is. So I think it's time to kind of talk about the pros and cons of being on statins, okay? So I've been doing some research online actually recently to see what kind of articles out there talking about statins. So two that really caught my eyes. Number one, the title is "Why Taking Statins Might Be Pointless and Even Bad for You." And this is an article dated to December 2010 from Daily Mail. And the second one is "Why I've Ditched Statins for Good," and it's from Telegraph, dated on the 23rd of March 2014. So some of you might be on statins already, or you know a bit about statins from friends. So this is a group of medication that help to lower your cholesterol. So there are loads of different statins. For example, the main one would be simvastatin. Then you've got some newer one called atorvastatin or rosuvastatin, etc. Okay. So people has been reporting that when they're on statins, they have some side effects, and some studies show that 1 in 5 actually have some form of side effects. For example, muscle pain, maybe diarrhea, and sometimes to a degree of memory loss or even blurred vision, etc. And apart from all these, they've also been studies that was done by St. George's University as well as University of Glasgow. Basically, what they did is they look into 5 studies trial on statin between 2005 and 2010, and they found out that those people, particularly on really high dose of statin, has an increased risk of getting diabetes type 2. And this is rather interesting, and they said that these people who are on high dose statin has an increased risk by 12% of getting type 2 diabetes. Now, obviously, if you heard about news like that, you will never take statin, because you're thinking, why am I taking something that's going to put me at risk of getting other diseases? But actually, you need to kind of dig deeper to see what statin actually does for you, and when is the right time or the right person to take statin, because it doesn't suit everyone, and not everyone needs to be on it. Now, for example, going back to the research that they did about increased risk of type 2 diabetes, the conclusion is that this is their finding, that some people have an increased risk of getting type 2 diabetes, especially if they're on high dose. But if you're having a very high risk of getting cardiovascular disease, especially those who have stroke or heart attack and so on and so forth, then these people, when they take statins, they would have benefit more than risk when compared to if they're not on statin, because they would have a higher cardiovascular risk. So the doctor and the patient will have to weigh it up to see whether they need to be on statin or not in that kind of circumstances. Okay, and now we'll look further into the article that I mentioned earlier on, with the title "Why I've Ditched Statins for Good." And basically it was written by a vascular surgeon, and he said that He went to see his GP and he was found to have very high cholesterol. He was saying that it's near 9 point something. And as I mentioned before, normal cholesterol should be around 5 and below 5. And you can see that 9 point something would be rather high. So obviously he took on board from the GP's advice and say, yeah, you need to be on a statin to reduce the cholesterol. So he was actually on it for quite a few years. And then he decided to kind of research into the pros and cons of statins and looking through different kind of studies to see whether he actually needs to be on it or not. Well, now, he said that he's been taking it religiously for a few years, then he decided to stop for a few months and see what happened. Then he actually told his GP that he has stopped. So initially the GP said, well, why don't you try a different kind of statin if the first one didn't suit you? Then he said, well, why don't we do some blood tests first? And the result came back, his cholesterol has improved to 5.4. Then he started to question then, because he said, well, when I was on cholesterol tablets, my cholesterol was high, but now I'm off the cholesterol tablet for a few months and my cholesterol is actually better than before. So is there a point of me taking that because it's not making me feel great? Well, but that's a point that I need to make here because, his cholesterol has improved, which is great, and he has had to stop the tablet for a few months. Now, that reduction of the cholesterol could just be related to he has been on statin for several years and it's actually working for him to lower his cholesterol. Now, stopping a few months is not going to shoot you right back up to 9.3. It's going to take time, which he in fact acknowledged that anyway. But he also mentioned something that is true, and I do agree with him, which is there's no point taking just statins if your lifestyle is not changing. Because I always said to my patients that no amount of cholesterol tablets or any tablets can help you to reduce your cholesterol if you don't change your lifestyle, because that's one of the risk factors that you need to kind of remove in order to reduce the cholesterol. Now, in previous shows, I've mentioned that sometimes we use a tool called the Q risk to help us to calculate how likely someone might get a heart attack or stroke in the next 10 years. So you've got a mild, moderate to high risk, and that helps us to decide whether someone needs to be on a cholesterol medication or not. Now, in the past, the government said we should consider starting someone on a cholesterol-lowering medication if the Q risk is 20% or more. And, of course, for those who already got pre-existing cardiovascular risk, and those people should be on statin anyway. But in the last few years, the government have actually said to us, well, actually should consider starting someone on a cholesterol-lowering medication if the Q risk is more than 10%. Now, then you can imagine that there will be quite a lot of people who are age 65 and over who would normally count it as healthy, but maybe the cholesterol is slightly raised or the Q risk is more than 10% for whatever reason, then they might be asked to be on a cholesterol medication. Now, so there's been some studies being done on this and to see whether actually statin is good for you or not if you're on a statin for a primary prevention reason only. Now, what we call primary prevention would be, let's say you're absolutely well, but you have a recent cholesterol blood test and you are found to be at slightly higher risk. So this is preventing you to have any cardiovascular events. And on the other hand, secondary prevention would be for those who has had pre-existing medical conditions already, and that is to prevent them to have another episode of cardiovascular events. So I've looked up a study that done by Cochrane Group, and they've shown that statin has more benefit than harm when you actually starting it for people to prevent secondary disease, but not necessarily for primary prevention. Which I think that, on my own opinion, I think this is fair enough, because if I found that you've got high cholesterol, and I will normally bring you in to have a chat just for you to know what is the situation. And if you say to me, look, Dr. Chan, I'm going to try hard to improve on my lifestyle and trying to lose some weight, for example, then I'll be like, well, that's fine, and we'll recheck your blood test again to check your cholesterol and see how you're doing. Because I always believe that doing it naturally is the way to go. And obviously in those who's got very, very high cholesterol already, then I might say otherwise. Now, you might say, what if I'm actually allergic to statin? I've tried statin before, different kinds, and I always have side effects. Then what can I do if I've got high cholesterol or high risk? Then there's something else out there for you, which we call the non-statins. So I'm going to mention two different medications which are non-statins here. So number one is ezetimibe. And this medication helps to reduce the amount of cholesterol that we absorb from the body, especially from the gut. This is normally used as an alternative to statins if you can't tolerate statin for whatever reasons. Or if you are, let's say you're on statins already, but your cholesterol is still rather high, then as a combination medication. But obviously, as you heard about the function of this medication is to reduce the amount of cholesterol being absorbed by the body, then in a way, then you have to make sure that you're having a low cholesterol diet, because if you're still having high cholesterol diet, it doesn't really matter how much tablet you're going to take. You're still going to absorb more cholesterol than you should. And I must say from day-to-day experience, for those patients who are actually getting quite a lot of muscle pains from their from being on statins, then quite a lot of the time they realize that ezetimibe works quite well for them. And this is definitely an alternative that should be considered if you tried different kind of statins already. Now, the other kind that we normally use as a non-statin would be a family called fibrate. So that's different kind of fibrate. So, for example, you've got bezafibrate, fenofibrate, and also ciprofibrate, etc. There are so many different kinds, okay? So the function of this medication is to reduce certain amount of lipids in the blood. And with all medications, you need to make sure that you are actually okay to be on it. Because, for example, if you have any kidney and liver problems, then maybe this medication is not so suitable for you. And in particular with fibrate, if you are at an older age, you need to be a little bit careful as well. Yep, so I know there's quite a lot of things to digest in 15 minutes time about treatment of cholesterol, but I would just make one or two final points. And number one is, for those people who actually has high risk, especially high cardiovascular risk, then being on a statin is definitely good for you, and the benefits outweigh the risk. And for those people who are only slightly high in cholesterol or had a really mild risk cardiovascularly, then maybe primary prevention like lifestyle changes, losing weight, eat healthily would be better than being on cholesterol tablets. But I must say that the most important thing is if you have any queries about your cholesterol or your cardiovascular risk, then it's always good to go and see your doctors to have a chat and get some more information about it. So I hope that you've enjoyed this show, and by all means write to the station if you've got any particular topic that you would like me to talk about, as I believe that interaction is the best. And until then, take very good care of yourself. Goodbye.
An opportunity for discussion. This is the 15-Minute Wonder on South Waves Radio.